joining this. This is very good for them, because I told them that this is their international, not just seminar, but this is international lecture for them.
Okay, shall we start?
Yes, please.
It's 10 a.m. already, and Mas Riki dan Mas Izzy, could you please help with muting all the participants? Okay, very good morning, all of you. Thank you so much for joining our monthly webinar of the ACAP Aging Consortium of Asia Pacific. And we are from Center for the Family and Aging Studies from Universitas Respati, Indonesia. For this year, we are hosting this the entire webinar. And today we have special guests from the Ministry of Health, Dr. Imran. Thank you so much for joining us. He's the Director of the Vulnerable Group Health Services, and he will share about our current situation of aging population in Indonesia. And luckily, this month of May is our National Older Persons Day. So that's why we invite our special guest today. And beforehand, of course, I would like to introduce to all of you our presidents. Professor Ogawa, could you please give us your opening remarks? Professor Ogawa, time is yours.
Thank you very much. And please, Sushana, operate my PowerPoint, please. Can you set up?
Give me 1 second, please. Okay. Okay. Can you get our slide?
Oh, yeah. Oh, thank you very much for participating in our monthly webinar. And today's ACAP monthly webinar focus on the oral health. Please enjoy sharing these meaningful tackles in Indonesia, Japan, and United Kingdoms. And in Indonesia, May is a significant month as the celebrations of National Elderly Days. To honor these occasions, we are inviting Dr. Ilman Pambudi, who is the Director of Vulnerable Groups Health Services, the Ministry of Health of the Republic of Indonesia. He will talk about current situations of aging and policies in Indonesia. Welcome, Dr. Ilman Pambudi. I'm very much looking forward to hearing from you later. Now, next, please. Next, okay, yeah, this is a message from Indonesia. Next, please. The Active Aging Consortium in Asia Pacific was established in Fukuoka City 21 years ago. At the beginning, 10 researchers and the regional leaders who shared these missions in our 4 regions, Japan, Hawaii, South Korea, and China, and has now become a network of 1,400 mailing lists in more than 40 countries. ACAP is a voluntary information sharing body open to peoples of all ages, abilities, and disciplines. Members are gerontologists, geriatricians, and educators globally, primarily in the Asia-Pacific region, dedicated to empowering older adults to maintain their physical, social, psychological, civic, economic, and environmental fitness so that they can continue to contribute to their families, their communities, and the society at large. Of course, active aging cannot be achieved through individual effort alone. Active aging cannot be achieved without social efforts. Therefore, we are holding monthly webinars and bulletins for sharing our knowledge and skills towards active aging society. Next, please. Next slide, please. Okay. Today's ACAP monthly webinar focus on oral health. Recently, there has been growing interest in the frailty, which is a declining health of the elderly. In an aging society, it is urgent to extend healthy life expectancy rather than simply increasing life expectancy. And it's necessary to prevent frailty. In the past, there has been effort to address metabolic syndrome, locomotive syndrome, and mild cognitive impairments. But in recent years, interest in oral frailty has suddenly increased. Therefore, this webinar was planned by Dr. Tribhuti Lahajos and Evelyn, important members of the ACAP in Indonesia. I would like to thank everyone, Susiana and Dinni, involved in the preparations work of the University of Respati, Indonesia. The presenters were Professor Dinni Agustine, Faculty of Dentistry, University of Indonesia, Professor Hogervost, University of Loughbrough, and Takeo Ogawa, President of ACAP. The moderator is Dinni Agustine from Cephas, University of Respati, Indonesia. Let's start the webinars with Dr. Irman Pambudi. Dr. Irman Pambudi, please give us your speech.
Yes, thank you, Prof. Distinguished colleagues, esteemed professors, and participants, allow me to first extend my warm greetings and appreciation to our distinguished speakers, Professor Takeo Ogawa, the President of ACAP and Professor Emeritus of Kyushu University, Japan, Professor F. Hogervost from Loughbrough University, United Kingdom, Professor Linda Kusdhany from University of Indonesia. So all of you, your expertise and dedication to advancing oral health and aging research are invaluable for us in Indonesia and across Asia. It is also an honor to join this important dialogue on oral health and longevity as Indonesia and Asia enter a new demographic area. The health of older persons becomes not only a medical issue, but also a societal priority. Today, Asia is home to more than 630 million older persons aged 60 and above, representing 60% of the world's elderly population. And in Indonesia alone, older persons account for 12% of our population in 2026. And these figures projected to reach 20% by 2045. So 12% in Indonesia now is around 34 million older persons in Indonesia. And more than 60% of Indonesian older adults live with hypertension, while 96% are physical inactive. We also found that almost 60% of older persons in Indonesia experience dental problems. This is a striking reminder that oral health is not a peripheral issue, but central to healthy aging, conditions that directly intersect with oral health, nutrition, and overall well-being. It is also important to note that Indonesia's healthy life expectancy currently stands at 60.7 years, which is still far below the national life expectancy of approximately 71.5 years. This indicates a gap of nearly 11 years, during which many older persons may live with poor health conditions, functional limitations, or dependency. So, Prof. and other colleagues, from our experience in Indonesia, we have learned several lessons. First, community-based approach matter. Initiatives such as Puskesmas Santun Lansia, or we call it primary healthcare, elderly friendly, show that integrating oral health into primary care can reduce frailty and improve quality of life. Second, holistic care is essential. Oral hypofunction, affecting up to 34 to 60% of older adults. It's not just a dental issue, but a predictor of systemic decline, including nutrition, cognitive function, and also social participation. Data and awareness remain scarce. Many elder persons, especially in a rural area, are underdiagnosed and underserved in oral health, which limits preventive action. So, looking ahead, the challenge for Indonesia and Asia are clear. First is scaling inclusive health services that integrate oral health into aging policies. So, ladies and gentlemen, since February 2025, we conducting free health checkup for every citizen in Indonesia. So until now, it's more than 7.5 million elderly already checked up with that program. Second, addressing inequities between urban and rural populations and between those with and without social protection. And the third, we should preparing for longevity societies where living to 100 years must mean living with dignity, vitality, and independence. We highly appreciate ACAP and CEFAS for this strong commitment and concern toward aging issues, as well as their continuous effort in promoting oral health and the path to longevity for older persons. We would also like to express our sincere appreciation for organizing this important initiative as part of the activities commemorating Indonesia National Elderly Day, which is celebrated annually on 29th of May. Indonesia National Elderly Day serves as a strategic momentum to increase public awareness in respecting, valuing, and caring for elder persons, while also encouraging the creation of more inclusive and age-friendly environment. We hope that this collaboration will continue to grow in advancing healthy and dignified aging, particularly for older persons in Indonesia and more broadly across the Asia-Pacific region. I would like to close with a reflection. A society's true measures is not how long its people live, but how well its elders are cared for along the way. Thank you. Good morning, everybody.
Thank you so much, Dr. Imran. It's very inspiring and challenging for all of us.
Okay, thank you so much, Dr. Imran and also Professor Takeo. And shall we move to the next session? I will invite Ibu Dinni as our moderator today. She will host our today's webinar. And Bu Dinni, time is yours.
Thank you very much. Am I audible? Okay, thank you very much.
Yes, very clear.
Yeah, thank you very much, Professor Tribudi and Dr. Susiana Nugraha for the meaningful opportunity. Distinguished participants, before we begin, please allow me to inform you of several housekeeping rules. First, please keep your microphone mute during the presentation. And participants are welcome to submit questions to the chat box. Kindly mention your name and institution or country. And the discussion, question and answers session will be conducted after all presentation has been delivered. Now we will proceed to the main panel sessions today webinar. It's now my pleasure to introduce our first speaker, Professor Dinni Agustine from the Fakulty of Dentistry, Universitas Indonesia. Professor Dinni Agustine has extensive expertise and international experience in the field of dentistry and health sciences. Today, she will present a topic entitled Oral Hypofunction in Older Adults, Implication for General Health and Holistic Care. Professor Dinni, please proceed with your presentation.
Thank you, Bu Dinni. Good morning, ladies and gentlemen. Good morning, Prof. Takeo. Good morning, Dr. Imran, and also Prof. Tribudi, Dr. Susiana, and all colleagues in this webinar. Thank you for inviting me to this. I thank you for inviting me to this prestigious webinar. Thank you, the CEFAS, for organizing this webinar, and also ACAP for establish this monthly webinar. And I'm very happy that oral health can finally become the center of this webinar. And I'm very happy that Dr. Imran also stated that now oral health already integrated in the general health. So I think Ministry of Health from Indonesia already taking notice of this concern. And allow me to share my PPT first. Okay. Yeah. Okay. Today, I want to present about oral hypofunction in older adults and its implication for general health and holistic care. Before I starting my presentation, I want to share that I came from Indonesia, and I come from it will also there is a decrease in occlusal force, and also decline in motor function of the tongue and lips, and also decline in tongue pressure, and both of them are related in swallowing process, and it will lead to the decline in masticatory performance or chewing function, and also decline in swallowing function. This is a graph from the Japanese Society of Gerodontology. From this graph, we can see that the condition of oral hypofunction is still reversible. So we don't want this condition to become oral dysfunction, because if it is already oral dysfunction, it is already irreversible. So we have to prevent this condition by several preventive measurement or preventive treatment. And this is another graph showed that the condition or the relation from oral hypofunction and oral function disorder. At first, there is a decline of oral health literacy, and this is lead to increased risk of tooth loss because of the oral health literacy in the community, and then leading to physiological and social frailty. So in this condition, it needs the population approach, like Dr. Imran said, that preventive is the best we can do. And the first one is to increase the literacy of the community of or the older adults about that oral health is important. And then after, if it is not taken, if it is a decrease in or decline of oral health literacy, it is also lead to oral function with slight problem. And after that, it will also follow or continue to oral hypofunction. And if it is also lead to sarcopenia and undernutrition. And if it is not treated well, it will leading to oral function disorder like dysphagia and masticatory dysfunction. And it will lead to nutritional disorder and morbidity and disability. And this is another graph showing that oral frailty components, it is related with others like sarcopenia and also the aging process. And it leads to malnutrition, sarcopenia, and frailty status. And this is become a cycle, and it is also will affect the cognitive function of the older adults. And other condition like polypharmacy and then malnutrition and then periodontal disease, it is also can worsening the condition of oral frailty. Several study has been done to show the relation between oral frailty, oral hypofunction, and general health. Kumigia et al. Stated that older adults with oral hypofunction are more likely to have sarcopenia, and oral hypofunction, Iwasaki et al. Stated that oral hypofunction associated with malnutrition. Nishi et al. Stated that oral hypofunction related to low protein intake. So from this, we can conclude that nutrition mediates the association of oral hypofunction with frailty and sarcopenia, and generalized loss of muscle mass, like in sarcopenia, is associated with loss of swallowing muscle mass. And in the community, we need a tool to screen our older adults by using simple tools that we can use in the community. So Tanaka et al. Develop index or instruments. We call it the Oral Frailty Index, or OV8. The OV8 is a validated equation designed to screen for oral frailty. It's the improving oral function and early identification intervention can improve the quality of life by we screen using this oral frailty index. The component of oral frailty index consists of 6 items or 6 questionnaires or 6 questions. One is about chewing difficulty, and then self-rated oral health, and then a question about tooth loss, and then wearing dentures. The other question is about dry mouth or serostomia condition, and then oral pain, and then difficulty swallowing, and oral ulcer or sores. And from this instrument, there is a cutoff who can differentiate between high risk of oral frailty and normal older adults. So it is the first measurement we took, and then after that we can do the prevention based on this screening, or we can also doing the more accurate diagnosis after that. And this is another graphs or charts showing that from oral condition, it can also affect the cognitive from two pathways. The first one is from periodontitis. It is an inflammation in the periodontal condition in the oral health. And then it leads to tooth loss. And then due to tooth loss, there is a masticatory dysfunction. And masticatory dysfunction lead to decreased cerebral blood flow. And it will have effect the mild cognitive impairment to become worsening to the dementia condition. And there is another pathway. It is from the chronic inflammation from periodontitis. Chronic inflammation also can affect the worsening condition of the mild cognitive impairment to become dementia. And interest has grown in the association between tooth loss, periodontal disease, and dementia. And tooth loss is an indicator of poor oral health. And there are several studies done about this topic. And one of them is our studies together with Professor Tribudi and also Professor Hogervost from Loughbrough University about the association between tooth loss and dementia. And these conditions could be directional. And with tooth loss, masticatory function is adversely affected. And the impaired masticatory function will affect nutritional intake and may lead to reduced cerebral stimulation and blood flow. And this condition will worsening the condition of dementia. This is another study that we have done together with Professor Tribudi and Prof. Hogervost. In this study, we do study, we use the denture. We measure the denture use and then the brain function. And from this study, we can conclude that the using denture can increase the occlusal contact, and then it will stimulate the brain function and give effect positively to the condition of the cognitive condition of the older adults. Because mastication effectively sends sensory information to the brain and maintain learning and memory function from the hippocampus. This is another study that we done. In this study shows that there is a significant correlation between all periodontal parameters, and it is related with cognitive status. So poor periodontal health, it means that many inflammation in the oral health is associated with cognitive impairment. And missing teeth will give effect to reduce of mastication and also leading to malnutrition or decrease of nutrition, and it is related with cognitive decline and also dysphagia, and this is become a cycle. And why it is important to take notice or take important state of oral health for older person with cognitive decline is that first we don't want our older adult to have aspiration pneumonia. Aspiration pneumonia is a lung infection with increased risk of mortality in older person. So by increasing the oral hygiene of the older adults with the cognitive decline, we will reduce the risk of the older adult to have aspiration pneumonia. And the second is that we want to increase mastication ability of the older adults by using dentures, and then it will lead to increased nutrition intake and will give a positive impact to the cognitive condition of the older adults. Another disease that I want to consider is Parkinson's disease. Parkinson's disease is a complex heterogeneous disorder with motor and non-motor symptoms, affected brain structures and cellular function. Parkinson's disease has a 1% prevalence in people 60 years or older, and patients with Parkinson's disease are at higher risk for developing oral health problems. And this will accelerate decline of quality of life and even increase the risk of death by aspiration pneumonia. This is the graph showing that in Parkinson's disease patient, there is a reduce of cognitive symptoms like mild cognitive impairment, and then depression, and then leading to dementia, and this will interfere with the patient oral hygiene routine. And then there is a motor symptoms like bradykinesia or tremors, dyskinesia, and this may impair the patient ability to brush their teeth regularly. And there is also a non-motor symptoms like dysphagia, sialore, and dry mouth, and this also will affect the bacterial accumulation increase in the risk of periodontal disease and caries. And this all will lead to poor oral health, and poor oral health will increase the risk of social impairment, and maybe the other dust will become low confidence or low self-esteem, and trying to reduce their social activity because of the condition of the oral health. And the other thing is aspiration pneumonia, and poor oral health will leading to aspiration pneumonia in older adult with Parkinson's disease. And oral health in patient with Parkinson's disease will facing chewing and swallowing problems, and then poor oral hygienes due to the condition of the patient like tremors, depression, or dementia. So it will increase cavity, periodontal disease, and also tooth loss. And then second is serostomia, decreased salivary flow rate and excessive drooling. And it is also leading to burning mouth syndromes, the condition that leads the patient will feel uncomfortable, and also leading to dysphagia. This is a sample case. This is a sample case of the patient coming to our dental hospital. This patient have Parkinson's disease and needs the oral rehabilitation using dentures. And but the condition is that this patient have serostomia. So there is a decrease of salivary production, and will also affect the retention of the dentures in the mouth. So for this patient, we perform or ask the patient to do the salivary gland massage. It is a part of the oral exercise, and by performing the salivary gland massage, we can increase the salivary production for this patient and increase also the condition of the oral health. And yeah. And other things is dysphagia. Dysphagia is difficulty in swallowing. And the symptom is associated with weight loss, malnutrition, dehydration, social impairment, poor psychological well-being, and risk of death through aspiration pneumonia. And the increased retention time of food material along the swallowing tract will promote bacterial growth and teeth and gingival deterioration, and this will increase the chance for aspiration pneumonia and mortality. And how we can detect that our older adults have a deterioration of swallowing function? We can use simple tools. It is questionnaires already validated in several languages, including Indonesia. We call it IT10. It consists of 10 questions. It is a simple question that can answer by the older adults. And by this questionnaire, we can detect the risk of whether the patient have the risk of deterioration of swallowing function. If the patient have a risk of swallowing, decrease of swallowing function detected by our by this instrument, and then after that we can followed by sending this patient to medical doctors, to the rehabilitation medics for continuous treatment for this patient. But from our side, we do performing some or preventive measures in oral health. This is another study done by our colleagues and also students about the what is the contributing factor of dysphagia in Indonesian elderly. And from this study, we conclude that the number of remaining teeth and then several systemic disease and AIDS is contributed most to the dysphagia status after recontrolling for confounding variables. So if the number of remaining teeth is more than, and the teeth only less than 20 in the mouth, it is increased the risk to have a dysphagia condition. And this is another study about the relationship of dysphagia and malnutrition relating to tooth loss in the elderly. And from this study, we can conclude that individuals with dysphagia exhibit fourfold increased risk of malnutrition relative to those without dysphagia. And individuals with education above elementary school are at a reduced risk of malnutrition compared with those with elementary school education or less. And the study indicated that patients with more than 20 teeth who are dangerous exhibit less dysphagia than those with less than 20 teeth in the mouth. And another condition that I want to stress in this presentation is that dentists can have a role in finding systemic disease that have manifestation in oral condition. Sometimes the patient didn't know that they have the disease or the systemic disease, but after we saw the oral health condition, and then after that we know that this patient have a systemic condition. For example, this patient at 67 come to our dental hospital to make a full denture. But after we saw the panoramic radiograph, we saw and then we do some measurement from this graph. We know that this patient have a reduced bone density. So it means that maybe this patient have osteoporosis or osteopenia. But to make sure of this condition, we ask the patient to take a bone densitometry. It is a gold standard to diagnose osteoporosis. And from the result of this bone densitometry, we found that it's true that this patient have an osteoporosis. And treatment for this patient, so that is not only making the danger for this patient, but also we consult this patient to the internal medicine so that this patient can have osteoporosis treatment by the internal medicine. And another samples is that this patient, it's 65. It is also came to our dental clinic or dental hospital to make a dentures. But after we perform several procedures for this patient, there is an oral lesion. So we consult this patient to the Department of Oral Medicine And then from the Department of Oral Medicine, perform a test for anemia. And we also doing the MNA test to analyze whether this patient have a malnutrition or not. And from this test, we know that this patient have anemia and also have a malnutrition. And so by this, we consult this patient to the geriatric medicine department to further treatment for the anemia and also the malnutrition. But from our side as a dentist, we continue to make a danger for this patient. And then hopefully by using the danger, it means that the mastication process, it will increase and will increase also the nutrition status of this patient. And this is the final the final of my presentation. I want to close my presentation by these words that together we can provide excellent care for our older population. So every health personnel and every people that will interest in treating the older adults have to hand in hand together to provide a holistic care and holistic care for our older adult population. Thank you.
Thank you, Prof.
Thank you.
Linda. I'm really impressed on your presentation. You are much better than me. Thank you so much.
Thank you, Prof. Hi, teacher. Always
Thank you very much, Professor Linda Kusdhany, for the insightful and comprehensive presentation. Your explanation has highlighted the important relationship between oral health, systemic health, and also holistic care among other adults. Ladies and gentlemen, we will now continue with our second speaker, Professor Takeo Ogawa, as the President of ACAP and Professor Emeritus of Kyushu University, Japan. Professor Ogawa will deliver his presentation entitled Fukuoka 100, an oral health initiative in achieving longevity. Professor Takeo Ogawa is a distinguished figure in the field of aging and health sciences, and we are truly privileged to learn from his perspective today. Professor Ogawa, the floor is yours.
Thank you very much for your kind introductions. And please share my picture slide for everyone. Okay, thank you very much. Today, I will tell you that in order to live a long and healthy life, it's necessary to prevent oral frailty. In Japan, this is called the prevention of oral frailty. It was one of the initiatives of the Fukuoka 100. Next, please. And the origins of the concept of the oral frailty in Japan was based on the large-scale survey of the elderly in Kashiwa study. Research learned from the Institute of Advanced Aging Society, IOG, at the University of Tokyo defined oral frailty. It was revealed that reduced eating, decreasing swallowing abilities, and weakened vocalizations were at the beginnings of the trends of the nutritious decline and cause sarcopenia and cause frailty and need for long-term care. Next, please. Then University of Tokyo teams developed the easy check of oral frailty, OF5, as a checklist to easily measure oral frailty. Decrease in the number of remaining teeth. I have only 90 or fewer natural teeth remain. Difficulty chewing. It's harder to me to eat hard food than half a year ago. Difficulty swallowing. I may choke on medicines or drinks. Dry mouth. I'm worried about my dry mouth. Slippery tongue lowered. I sometimes cannot pronounce words clearly in everyday conversation. A condition in which two or more of these minor declining overlap is oral frailty. Next, please. The University of Tokyo Research Institute for Aging Society developed also a checklist of the syndromes of oral frailty, point of yes. And compared to 6 months ago, it has become difficult to eat hard foods, 2 points. Sometimes chokes on tea or soup, 2 points. Dentures are in place, 2 points. I'm worried about dry mouth, 1 point. Compared to 6 months ago, I went to or less, 1 point. Inability to chew firm food, 1 point. Do not brush my teeth more than twice a day, 1 point. Don't go to the dentist more than once a week, years, 1 point. If you evaluated low 0 to 2, low risk. 3, caution of oral frailty. 4 plus, this is a high risk of oral frailty. Next, please. In other words, oral frailty can be seen as earlier symptoms of the domino or breaking negative effects caused by lifestyle habits. By noticing the improving this change of negative effects as soon as possible, we can prevent it from getting worse. Next, please. Next, please. The field of oral frailty prevention is a common issue across professionals, and professionals can be involved and various perspectives, not only the dentist. Each profession can be practices from its own perspectives. This is the tables of the professionals and the focus points and practices. It's illustrated. Next, please. Therefore, the Japan Geriatric Society, the Japanese Society of Gerontologists, and the Japanese Association of Sarcopenias and Frailty collaborated to issue a statement of agreements of oral frailty. In the statement, it was revealed that oral frailty is not directly affected by gender or age, but is strongly affected by medications and lifestyle disorders called social frailty. Next slide, please. This slide is already Linda explained, then I cut off. Next, please. Next slide, please. In the oral frailty stage, we can improve through training in Japan. Developmental exercises called patakara exercise and aiube exercise are often used. There are also exercises to put off or puff off or pass our cheeks. Other programs such as chorus, laughter yoga, and chat sessions are also said to be effective for oral frailty. Next, please. Therefore, in the preparation for the arrival of the 100-year life era, Fukuoka City decided to try to the concept of the Fukuoka 100. This initiative promotes 100 action to achieve a healthy social model anticipating the era of 100 years of life. The oral frailty prevention program was one challenge in this initiative. Please, next slide. Next slide, please. Okay. Under the first phase of the Fukuoka 100, an integrated database of health insurance data and long-term care insurance data was established. Based on this big data, the laboratories of Professor Toshiharu Ninomiya at Kyushu University School of Medicine conducted an analysis to reveal what kind of a lifestyle increases the risk of the long-term care and how much. According to the result, being lesser weight was the highest 2.17 times higher risk than that of the ordinary people. Next, it was found that slow walking had a 1.86 times risk, and those who could not chew well had a 1.51 times risk. Therefore, Fukuoka City has implemented 4 measures to prevent oral frailty. 1, local extensive lectures. Dental Association take responsibility. Basic frailty check, pharmacy, and the medical association collaboration and making these activities. The frailty prevention consultation services based on pharmacies. The oral frailty check at the place of commuting. This kind of activity is managed by the cities. Next, please. One of the problems with dental care in Japan is the reality that dental visits are low in the adolescents and adults. When people were children, they checked their oral health, but later to 20s, their dental visits decreased. The rate of the dental examination increased slightly due to the health checkup when getting a job. But people do not visit dental doctors when they were children. And during these times, there is a high possibility that oral frailty will progress. Next, please. Then, in order to maintain good physical conditions, the Oral Care 28 project worked with the pharmacists, dental associations, public health nurses, and others to promote the concept of the oral frailty and its prevention training. Especially age groups of 18 to 20 and 35, 40, 50, 60 are targeted for dental examination by public health. The number 28 means that there are more than 28 teeth that can hurt food deliciously. Next, please. Though these initiatives, dentists in Fukuoka City have facilitated on-site lectures, oral function tests, and oral gymnastics instructions. Pharmacists implemented frailty basic check, awareness raising, and physicians collaboration, and medical doctor tackled to re-evaluation guidance and the use of frailty health handbooks. Fukuoka 100 Plaza, which were redesigned on welfare facilities for older persons, also promoted oral frailty check, questionnaires, and gymnastics. Next, please. These efforts, together with the result of other long-term care prevention efforts, have yielded the following result. From 2015 to 2025, the proportions of people existing for health promotions and long-term care prevention increased by 5.2%. The number of training practice stations increased by 3.8 times. The number of people aged 65 and over increased by 70.3% from 2015 to 2023, but the growth in the number of people certified as requiring support was limited to 13.1%. The average age of men who received the certification of requiring long-term care 2 or higher delayed by 1 year from 80.6 years to 81.6 years. And for women, from 83.5 years to 85 years, it delayed by 1.5 years. The difference between healthy life expectancies and the average expectancies for men reduced by 0.6 years from 2019 to 2022, while for women, if it was reduced by 2.0 years. Okay, final one, please. Then Fukuoka 100 appealed for the prevention of the oral frailty. The message is, teeth are partners for 100 years. It's an easy to understand slogan. So please share it with everyone and spread it. Thank you for your attention.
Thank you very much, Professor Takeo Ogawa, my mentor for 17 years. Thank you so much.
Okay, thank you very much, Professor Takeo Ogawa, for your inspiring presentation and thoughtful perspective on oral health initiative and longevity. Your presentation reminds us that healthy aging requires interdisciplinary collaboration, preventive approaches, and strong community engagement. Distinguished participants, originally our third presentation was scheduled to be delivered by Professor Hogervost from Loughbrough University, United Kingdom. However, due to her health reasons, she is unfortunately unable to join us today. We sincerely send her our warm wishes for her speedy recovery. Okay, before we continue, may I invite everyone to send warm greeting, applause, and positive emoticon in the Zoom for all our distinguished speaker and presenter today. Yeah. Thank you. Thank you very much for the wonderful enthusiasm and positive energy from all participants joining us from different countries and different institutions. Now we have reached our discussion and question-answer session. Okay, let we see in the chat box, or you can raise your hand virtually to share your question. Okay. Let me check in the chat box. Okay, we have a question from Zafira. Good morning, dear Prof and Prof. I'm Zafira from University of Respati, Indonesia. I would like to ask to Professor Linda, based on her presentation about OFE8, could I non-dentist doing the screening with the tool to the elderly? And is there any criteria if the result need referral to the expert or dentist? Second question to Professor Ogawa. Thank for sharing us about Fukuoka 100 project and its benefit to the elderly. But is there any challenges that the researchers face while doing the project? Thank you. Yeah, Professor Linda, actually you can read the question in the chat box.
Okay, thank
Yeah.
you. Thank you, the Dinni and Bu Dinni and Safira. Ya?
Safira, yeah.
Ask the question. Yeah, OV8 can be used by non-dentists because it is a very simple question. Like, and in Japan already use the OV5, but we in Indonesia still use the OV8, and in this process to adapted and validated the OV5 to Indonesian language. We think that OV8 is more comprehensive, more detail in every item than OV5, but OV5 is more simple and it is easy to use in the community. But both of them can be used by the non-dentist because actually the patient can fill in by themselves the questionnaires because it is very simple. And for OV8 there is a cut-off point. If there is more than less than 4, it is mean that there is a risk of oral frailty. So with this concern, we may consult this with the health personnel, maybe the dentist or health personnel in the public health centers to take more detailed measurement of the condition. Yeah, I hope it is answered the question. Thank you.
Thank you, Prof. Linda. And now to Professor Ogawa. Would you like to answer the question from Zafira? She asked about Fukuoka 100 and its benefit to the elderly. Is there any challenges that the researchers face while doing the project?
Yeah, and Fukuoka 100 is a focus on the collaborations between professionals, academic professionals, and public governments, and also the industrial world and citizens' activities. This collaboration is a multi-stakeholders activities. Then this oral frailties issue is not only for the academic researchers issues. It's a much wider issues for the everyone. Then, for examples, one companies making some joint researches with the academic researchers. For this company is a chewing gums product companies, and making some check chewing gums change the colors, chewing power is evaluated the colors based on the colors. This kind of new products should be developed with each others and making the availabilities for the every persons. This kind of how to awareness of the important meanings of the concept and sharing and making some new steps for evolving the solutions of the issues. This is Fukuoka 100 approaches.
Thank you, Professor Takeo Ogawa. We have second question from the Netu Batra from India. The question is, what about the socioeconomic condition of the sample size and their family type? Are you all deal with in this project? This is for you, Professor Linda and Professor Takeo, I think. About the socioeconomic condition of the sample size and their family type.
Maybe Prof. Takeo answer first.
Professor Takeo, is there any socioeconomic condition of sample size?
Yeah, in Japan, Japan is the highest aged society now, and maybe every country follow up Japanese path, and maybe in near futures, every country working same way in Japan, yeah, and then Japanese society now focus on the our very severe social economic conditions. And there are a lot of the older persons, but there are very few numbers of the working peoples. And now is 5-person, two-person support one older persons. This kind of a very severe conditions. Then older person take care by themselves their own healthy life and don't depend on the younger generations. This is a very important things. And how to promote, enhance the healthy aging is a very important issues for older person, but not only the older person, but also the supporting populations. This is a Japanese social economical condition backgrounds. Yeah.
Thank you very much, Prof. Takeo. And there is a third question from the Taiwan.
I can adding something.
Oh, okay. Oh, sorry, Prof. Linda, please.
I want to add that I think that socio-economy condition is very related because in Indonesia condition, the social economy condition is highly related to the degree of education of the community. So it means it also relate with the oral health literacy. So it is all a correlation. So with but in our study, this variable of social economy is not found as the #1 predictors because we controlled it. Maybe because the limitation of the subjects we include in our study, but in overall in our community, I think the social economy is really have an impact to the and related to the oral health literacy. Yeah,
thank you, Prof. Linda. I hope this can answer.
Thank you, sir. Thank you, ma'am.
Yeah. Maybe Paisan can open mic for your question. You can directly ask to our speaker.
Yeah, we are also trying to figure out, is there any like easier or cheaper way to improve oral health? And one of the things we often advise to people of all ages is to chew chew more times before swallowing the food, but I don't know if this is a good advice to increase the saliva and a better mixture of the food. And also, I'm wondering if there is a guideline, like how many times usually we should chew before swallowing. Thank you.
Okay.
Maybe I try to answer the question.
Thanks, Prof. Linda.
I think chewing is better. How many chew? I think that there is no exact numbers of chewing cycle that is normal or not, because it depends on many condition, like maybe the food textures itself, and then the saliva of the older adults, and then also the age, because it is also related with the muscle condition of the oral health, and also the tongue pressure, and also it is also affected by the swallowing function. But for common we can say that 20 or 30 chewing cycles before swallowing for ordinary solid food, yeah, it is considered as normal. That is, we call it normal. So I cannot answer how many exact, because it is all depends on the quality, the consistency of the food itself. Yeah, thank you.
Okay, I have another question about the gum chewing, because I did study on centenarians in Taiwan, and many of them did not have teeth. They were toothless, but they chew with their gums, and they seem to be okay. So I was wondering, how about gum chewing?
You mean chewing using their gums, not teeth? No,
Yeah.
they don't have teeth. I'm not recommended it, because it is different between the function of the teeth and the gums itself. So we cannot chew it properly using only the gums. For this kind of patient, I think better to ask them to making a danger for their condition. Yeah.
Yeah. Okay. Thank you very much. Thank you.
Thank you, patient, for your question. We have still time to the like question. Maybe I can choose the question from the Hong Kong. You can, yeah, you can direct open your mic. Stanley Xu. Hello, Stanley. Stanley? Okay. And from Masdi. Yeah. I would like to ask, how important is maintaining oral health and supporting healthy aging and also increasing longevity, especially in elderly population with chronic disease? This is the question from the chat. Who would like to answer this question?
Yeah. Prof. Takeo, maybe first you can answer, or
Yeah, and I will say the nowadays the we not concerns the average life expectancy no more. We are focused on the healthy life expectancies. This is very important things. Then we focus on the preventions activities for healthy life. This is one answer for the question. Yeah, and based on this fundamental approaches, and we already prolong our average life expectancy, and Japanese society is enjoyed the longevities, but we need to the longevity should be much more healthy and well-being conditions. How to make it? This is a very important things for this thinking later life. Then this kind of oral freightage issues is closer up, and now challenged to making some tackling to solutions of these issues. Yeah, these are my answers.
Thank you, Prof. Takeo. Okay, one last question from Hong Kong. This is question for Professor Linda. Yeah, I think. Because the question is, I'm not expert from dental science, but my question to Professor about, is your research or screening including the degradation of tone sensation among old adults who may intake more salty or sweety food or add more sugar or salt in their meal that may also impact to their health in the long run? What do you suggest about it, Professor Linda, please?
Yeah, thank you for the question. Up until now, I haven't had a research about the taste sensation, but I think it is interesting, and we can try to do the research in the future, because in older adults we already know that there is changes in the taste sensation, and due the several conditions of the oral health that affect the taste sensation, and it will reduce also the taste sensation. And I think that with the reduce of taste sensation, it will also affect the nutrition intake, yeah, because the it is all related. But unfortunately, I don't have any study about that, but I think it is an interesting topic to our next future research. Thank you.
Okay, thank you very much, Professor Linda, Professor Takeo Ogawa. Thank you very much to all participants for the excellent question and active participant. Once again, our deepest appreciation to all distinguished speaker and presenter for sharing their knowledge, experiences, and also inspiring insight with us today. Okay, before we conclude, please allow me to invite to all participants with a special invitation about the Urindo Ed Summit 2026. This is the celebration of 40th Disnatalis of Universitas Respati Indonesia. So we proudly present Urindo Ed Summit 2026. This is the first Urindo's Aging, Growth, and Entrepreneurship International Conference. The conference will bring together international scholar experts to discuss multidisciplinary approach to sustainable livelihood and digital inclusion. We warmly encourage all participants, academic, researchers, students, and practitioners to join this meaningful international event on 30th May 2026 via Zoom meeting. We look forward to welcoming you to Urindo Ed Summit 2026. On behalf of the Center, Family and Aging Studies, Universitas Respati Indonesia and the Active Aging Consortium for Asia Pacific, or ACAP, we would like to express our sincere gratitude to our distinguished speaker, Professor Takeo Ogawa, Dr. Imran Prambudi, Professor Linda Kusdhany, and all participants from various institutions and countries. Before we close this webinar, please allow me to summarize several important points from today's session. First, oral health is essential component of healthy aging and should not be separated from general health and well-being. And the second, oral hypofunction and poor oral health condition may become early indicator of broader health problems, including nutritional issues, chronic disease, and also cognitive decline. So preventive strategies, early intervention, research, education, and interdisciplinary collaboration are crucial to improving quality life among other adults. Community-based initiative and policy support play important role in creating healthier and more age-friendly societies. And international collaboration, such as today's webinar organized by CEPAS Urindo and ACAP, is essential in strengthening knowledge exchange and promoting innovative approaches toward healthy longevity. Ladies and gentlemen, finally, I'm Dinni Agustine as a moderator, officially closing today's webinar. We truly hope to meet you again in our next monthly webinar activities. Thank you very much for your participation and valuable engagement. Stay healthy, stay active, and we hope to see you again in our future program. Wassalamualaikum warahmatullahi wabarakatuh. Salam,
Excuse me,
day,
Dinni.
and
May I
goodbye.
congratulate and thank you so much to Professor Lindawati, Professor Takeo Ogawa, and also you as a moderator. It's really amazing. Thank you so much for everything.
Thank you very much, Prof. Tribudi. Thank you,
Thank you.
Professor
Bye-bye.
Takeo,
Thank you.
Prof. Linda, Donghi, Professor
Thank you,
Passion.
Dr.
Thank you very
Susiana is
much.
our young leader, actually.
Excellent. Thank
How
you,
will take a picture of
Professor.
us?
Happy to host all
How
of
will
you.
take a picture of us?
Thank you all.
Okay,
Bye-bye.
Sure, yeah, let's take a picture.
take a
Please
picture of us.
open your
Okay.
Mas Iki, tolong
Okay,
difotoin.
we take
semua.
picture. We have 4 page. Please open your camera.
Halo Teresa.
Hi.
Please open your
Hi,
camera.
Teresa.
Hi.
Ini sukses, Prof. Tribudi, Prof. Tagawa.
Okay.
Hello.
Pengen ke
Okay.
Fukuoka
We
lagi.
take picture. Page 1, 1, 2, 3.
Thank you.
Wait.
Okay, thank you.
Wait.
Wait, one more
Wait.
picture.
One more. Because 100 participants. We have 100 participants, okay?
Page
Yeah.
2.
Amazing.
Okay. Wait. Page 3. Okay. The last page. 1, 2, and 3. Okay, thank you all.
Thank you so
Thank
much.
you.
Thank you very much all.
Thank
Thank
you.
you, Prof. Linda.
Have a nice
Thank
Excellent.
you,
month.
Dr.
Just in
Susiana.
Thank
Thank
time
you,
you,
to
Prof.
everybody.
close
Tri, Prof.
our
Linda, Prof.
webinar.
Very
Ogawa,
good.
Dr.
Prof.
Imran. Thank
Ogawa.
you so much.
Ogawa.
Next
Dinni,
webinar.
you are the best
Okay,
moderator today. Thank you
Arigato.
so much.
Fukuoka again.
Ke Fukuoka lagi. Thank you.
Hai, Dr.
Prof.
Dewi.
Ogawa, see you.
Hai,
Ini.
Dr. Dinni.
Oh, I think you are the best moderator this year.
Iya. Sampai jumpa.
Sampai
Oke,
jumpa.
izin pamit.
Pamit.